Hi friends, good evening you all. I am Dr. B. Jagdish, diabetologist, preventive cardiologist and consultant family medicine. And to continue, this is a series of videos regarding diabetes and all about diabetes. And in the first video, we talked regarding what is diabetes. Basically, we talked regarding the definition and the components of diabetes. Friends, this is the second video in the series, and we will continue this series with different topics on a different date, and I have planned it like that. It will be small video, not to make it very lengthy, very small video, and it will be we will be discussing very specific things which for all the diabetic patients, and also all we all can learn from this. Okay, you can use this as a reference guide whenever you feel like any doubts. You can refer these videos, and let us start today's topic. What are the types of diabetes or the classification of diabetes? Basically, we'll talk today. Actually, the type of diabetes doesn't matter, but it matters what type of treatment to begin with. Okay, once we diagnose what is the type of diabetes, it will be very clear regarding which treatment to start with. Like let's start with. Basically, diabetes is three types. Is of three types what we see in our practice, day-to-day practice. But there are other types also. I will let you know the things. But there are basically three things you must have heard. That is type 1 diabetes, type 2 diabetes, and gestational diabetes mellitus. Previously, type 1 diabetes was being called by the name of IDDM. That's a misnomer, and that is gone now. That is insulin dependent diabetes mellitus. And also it was called juvenile diabetes because basically it was found in young children. Okay, in very young children, infants. So it was juvenile onset diabetes mellitus. It was called, but all these nomenclatures, they are history now. Now WHO and all the international diabetic agencies, we term it as type 1 diabetes, in which there is absolute deficiency of insulin secretion. So one needs to take insulin injections. Body doesn't produce insulin, and the causes are many. And let us not go into the causes today. Just understand the type 1 diabetes. In type 1 diabetes, there is no insulin, that is zero insulin production, and all the beta cells, because all the beta cells which produce insulin are gone. So we have to get insulin from outside. So the treatment lifelong is insulin. Now moving on to type 2 diabetes, that is numeric. When I tell type 2, I mean by that type 2 numeric, that is numeric 2 diabetes. And previously it was called non-insulin dependent diabetes mellitus, NIDDM, but that is a misnomer now, or it's an adult onset diabetes. But those two are gone now. We are clear that it is a type 2 diabetes. What happens, previously we thought the type 1 diabetes, they need insulin, and the type 2 other type, that is type 2, they did not need insulin. So it is non-insulin dependent diabetes mellitus. But afterwards it was found that towards the end, after many years of having this NIDDM, that is type 2 diabetes, many patients, they need insulin to thrive, or else the blood sugars get out of control, and there are complications, they build up in small time. So now it's clear that it's a type 2 diabetes where there is relative deficiency of insulin, and along with insulin secretion that is reduced, and there is a deficiency or relative deficiency of insulin action, what we call insulin resistant. That insulin is being produced by the body but it's not able to work. So that's basically type 2 diabetes. And the third type, which is now getting commoner nowadays, it is gestational diabetes mellitus. That is when we find the diabetes for the first time in pregnancy. Sorry, diabetes to be diagnosed for the first time during pregnancy. Sorry, my dear friends. And so gestational diabetes mellitus, and in that actually it might be the case like previously undiagnosed type 1 diabetes, or previously undiagnosed basically type 2 diabetes, that may present as a gestational diabetes mellitus, as pregnancy is a high stress condition, so diabetes arises in that. So these are the basically we discussed, these are the basic three types of diabetes: type 1 diabetes, type 2 diabetes, and gestational diabetes mellitus. Now there are other types of diabetes mellitus. Basically they are diagnosed mostly in India. India has a great contribution to the field of diabetes. And other types of diabetes like MMDM, malnutrition modulated diabetes mellitus, because of malnutrition. Nowadays we find little lesser cases. And others like it is because of pancreatic stone, pancreatic diabetes. So that's known as FCPD, that is fibrocalcific pancreatic diabetes. That's basically because of pancreatic origin. Pancreas is exogenous pancreas. It is destroyed pancreas due to the stone, pancreatic stone, and diabetes happens. And the other two, that is a genetic defects. It happens, the diabetes, and there are various types in the subtypes. But basically these group of diabetes, they are termed as MODY, that's maturity onset diabetes of the young. And the treatment varies for the different subtypes. Some they respond lifelong to tablets, and some they need insulin from the very beginning, or some just they behave like type 2 to start with. They need tablets and they stabilize, then they will need insulin towards the end. And there is another variety that is known as LADA, LADA, that is latent autoimmune diabetes of the adult. So what happens towards the end, the diabetes is diagnosed towards the end, like after 35, 40, but they need insulin, then do not respond, or they respond for the first 6 months, they will respond to the tablets, and they will finally they will need insulin to thrive. So it's basically type 1 diabetes in the adult. So that is latent autoimmune diabetes of the adult, where all the beta cell is gone at a certain stage for some reason. So friends, today we got to learn the types of diabetes. To recapitulate, there are basically three types of diabetes. You remember these things, simple: type 1 diabetes, where no insulin is produced, and type 2 diabetes, where initially insulin is produced, and later stages in insulin secretion may be totally absolutely zero, and but there is initial reduced insulin secretion along with reduced insulin action, that is insulin resistance. That is a combination. The third thing, when we first encounter the diabetes, when we first encounter in pregnancy, during pregnancy, early days of pregnancy, so that we called gestational diabetes mellitus. And basically how do we diagnose that it's particularly for the first time, that is it's pure gestational diabetes? Because usually most of the patient the diabetes is reduced or it is cured after delivery of the baby. The mother, when you test this after delivery, the blood sugar will be normal. So that is the true diabetes in pregnancy. Okay, gestational diabetes mellitus. but they have the highest risk of developing type 2 diabetes in next 6 months. So you have to make sure that you follow a strict lifestyle modification measures, okay, diet restrictions and exercise, to prevent the onset of diabetes in future. And other types of diabetes, we knew those are genetic, due to genetic modification, that is MODY, maturity onset diabetes of the young, and the LADA, latent autoimmune diabetes in the adult, and the other forms which were rarer forms, that is FCPD and MMDM. MMDM is malnutrition modulated diabetes mellitus, and there is a fibrocalcific pancreatic diabetes. So that's all in a nutshell. We come to know what are the type of diabetes. So if you like the video, kindly like the video and subscribe to our channel to get more videos in future. You can share this video if you like it on all social platforms, and if you want me to talk on specific subjects, then do kindly respond in the comment box. I will be happy to make a video on that topic. Thank you for watching this video. Good night. Hope you did understand type of diabetes well. Thank you. It was nice talking to you people. Bye bye.